So my name's Abby and I'm a full-time PhD student here at the University of Liverpool. I'm based within the Institute of Ageing and Chronic Disease and also within the School of Engineering on a joint project. So as the title suggests, my project is all about the biomechanics of the ageing human knee. So what is biomechanics? It's the study of the mechanical laws relating to the movement or structure of a living organism. So there's two different types of biomechanics, and the first is sporting biomechanics. So you might be thinking, what does a biomechanist do on a day-to-day basis? Well, essentially, their job is to work with an individual athlete or a sporting team to improve their performance. And what they really want to do is optimise their techniques, and they can also assess their body loading patterns, their muscle recruitment patterns, and any conditions that they may have to help prevent injuries during their sporting performance. They can also assess any sporting equipment that they may use. So, for example, a tennis player or a golf player, they would assess their racket or their club and see how that actually moves with them during their sporting movements. So the second discipline is clinical biomechanics, and this is more what I'm involved in. And essentially what this does is looks at healthy and also pathological populations in order to understand the mechanisms behind a clinically orientated problem. So what does that mean? It means that you would assess, again, the same with sporting biomechanics, their body loading patterns, their muscle recruitment patterns, and it's all in the aiding of diagnostics and therapeutics. And what you're essentially trying to do is create rehabilitation programs for patients in order to make them healthier and try and prevent these conditions in the long run. It can also be used with biomedical engineering, so that's another sort of discipline that I'm involved in. And this can be for prosthetics, so for example amputees. It can be for joint replacement, so you would design implants for individual patients, and there's also involvement with robotics as well. So I'm going to tell you a little bit about my PhD research. Essentially, it's on arthritis in the knee. So I'm sure you've all heard of arthritis, and there's many different forms of it, but osteoarthritis is just one form, and it's a type of inflammatory disease, and I'm mainly focusing on the knee. So it's a really prevalent condition and affects up to 40% of adults over the age of 70. So that's huge statistics, and unfortunately it's only on the rise. I'm not sure if any of you may have seen that earlier in the year, the World Health Organization released a report on obesity, stating that up to 50% of adults might be obese by 2050. So you're talking about half of the adult population, and this is a primary risk factor for osteoarthritis. So what is the condition? You'll see from the X-ray up on the screen that it actually causes structural degeneration within the joint, and it causes a wearing away of the cartilage. And you'll see on the right-hand side that the femur bone is actually in contact with the tibia bone, and it's caused by the wearing away of the cartilage, meaning that there's a narrowing of the joint space. And ultimately, once this progresses, this can lead to pain and a decline in function of the patient. They're unable to carry out their daily activities, and it's a really prevalent condition. So the aims of my PhD are to essentially compare a young, healthy knee joint to an elderly osteoarthritic knee joint and see what the differences are. So all of the labels that are up on the screen, they're the type of tissues that I'm going to be looking at throughout my project. And I'm going to go through two stages on my PhD. So the first one is an experimental stage. And moving on from the tissue engineering that we were just presented with, I'm going to be doing some biomechanical testing and biochemical and biomechanical testing on all of these tissues. So I'll be looking at all the content of these tissues in the healthy and the ageing knee joint. And just for example, it's proteoglycan, elastin and collagen content. And I'll see how these either increase or decrease in an osteoarthritic sample. I'll then move on to materials testing, and I'll be doing this in the School of Engineering here. And I'll be looking at compression, shear and tensile forces on all of these different tissues. And essentially what they're going to do is mimic everyday activities that a knee joint is subjected to but in an artificial environment. So following this, I'll go on to the second stage of my PhD, and I'll be going through a modelling stage. And using the data that I've collected, I'm going to build a 3D model of a healthy knee joint, and then a 3D model of an osteoarthritic knee joint, and run a set of simulations through this knee joint to see how they react under different circumstances. Now on this model that you can see up on the screen, it's an example model. You can actually ask the joint to do repetitive loading. So you can ask it to go through flexion and extension on a repetitive basis. And what we'll do is get it to mimic walking, running, jumping, everyday activities that we would be subjected to. And then eventually we'll relate this into therapeutic interventions. So when you have osteoarthritis, in clinical practice, you're often given a blanket intervention. All patients are given the same treatment. And it's more and more common now that medical research and medical therapeutics need to be individualised. So hopefully we'll be able to relate the project back to that. So that's my PhD in a nutshell. And as I've only just started my PhD, I thought I would tell you a little bit about my STEM journey. I'm probably only a couple of years ahead of some of you if you're sixth formers or undergraduates. So I went through the very typical GCSE BTEC route, and then I went on to Bournemouth University and did my undergraduate degree in exercise rehabilitation. So it's essentially a little bit like physiotherapy, and I learned how to work with these patients with osteoarthritis and various other conditions to actually give them the rehabilitation they need to become better. Following on from that, I would do a master's in biomechanics at Roehampton University in London. And from there, I sort of grew my interest in musculoskeletal biology. So whilst I was at my undergraduate and my postgraduate degree, I did lots of placements, lots of volunteering. And for any of you that are maybe slightly earlier on in your career, from myself, I couldn't recommend them highly enough. I did a lot of clinical placements in hospitals and out in the community. And at one point I was really set on going into neurological rehab, so working with patients that have had either stroke or brain disease and learning how their musculoskeletal system changes after this process. But unfortunately I did a placement at a neurological care home, and the real life practical is very different from the theory side of this research, and it was something then that I realised I didn't want to do. So I would definitely recommend you going to do placements in an area where you feel like it is an area of interest. Following on from that, I worked in industry for a little bit, actually working with these patients with osteoarthritis and delivering these rehab programmes out in the community for the NHS. So some of you may be thinking, well, how did you realise what you wanted to do? I'm either in sixth form, I'm an undergraduate, and I'm not quite sure where this is going, I'm not quite sure what my next step is. Well, all I can suggest you is I never really had that light bulb moment. I never really thought this is definitely what I want to do when I grow up. But actually I used all of my experiences and took the good bits and the bad bits and sort of worked out logically what was my next step going to be, based on the bits that I enjoyed. So finally, STEM, science, technology, engineering and mathematics. It's multidisciplinary, and my project is a prime example of that. I use biological science for the arthritis condition. I use technology every day. I'm computer-based, I'll be building a computer model. I use engineering principles to test the materials, and mathematics comes into the modelling. So STEM is a multidisciplinary subject, and if any of you are just in one of the subjects at the moment, hopefully today will make you realise that you can go into more than one of them, and that actually we're promoting the subjects that Liverpool supports. Thank you very much.